Tonight, we thank and celebrate you. You have many different reasons for being here. And one absolute thing in common with all of you is that everyone wants the best for our children.
It is truly an honor to be part of a team that strives for the very best for our kids every single day. I'm also a mom whose son is healthy and thriving today because of the incredible team here at the Alberta Children's Hospital. A mom who will be forever grateful to this community because of the donations that helped save him. Everyone who works at our hospital understands we need to do more than save infants and children's lives. We need to save the quality of the rest of our lives, and you help us do that.
My whole life, I've always strived to be the absolute best at whatever I was doing. While it's normal to want to do well in school, the pressure I put on myself to excel in high school was over the top. I could hardly sleep at night, I was so worried about my grades, and the littlest setback would send me spiraling. My doctor referred me to the Emerging Adult Treatment Clinic. I saw a psychiatrist who told me about this interesting research project studying the possibility of doing genetic testing to help choose the best medications for anxiety and depression. I thought, why not? What do I have to lose? A few weeks later, the test revealed there might be a better drug to try based on my genetics. Incredibly, once I changed meds, I noticed that, for the first time in a long time, I was in a good mood. The future looked brighter. That study changed my life.
My name's Talon Spring. I'm 9 years old and I love my big sister Letty. Letty's 12 years old and has epilepsy and cerebral palsy, which makes her have seizures and affects her brain. We love going to the lake. I push my sister's wheelchair when we go skating. I love helping her. The hospital gave Letty the chance to try something called Trexo. It's kind of like a robot that she wears. It helps my sister move her legs and walk. It lets us play together. We get to go for walks. She gets so happy. The Trexo is how Letty really started talking. When she was in her wheelchair, people would talk above her so she couldn't really understand. And when she was in her Trexo, people were making eye contact and speaking face to face with her. So she started talking. She can say a lot of words now, like da for dad. She goes T for me. Then she says mama, night, bye-bye, and she can say love you. And when we're talking about her, she goes me. The hospital is an amazing place and it helps so many kids. And even though we're not doctors or nurses, we can help too. Good job.
Summers ago, I had some horrible pain in my stomach. Reluctantly, thanks to my mom, took me to the Children's Hospital and sat down with Dr. Mel. And she was using all these kind of words that I couldn't really understand. I couldn't really understand the gravity of what she was saying. And then she said I had what is called lymphoepithelial carcinoma. I know, took me a minute. You don't know how many times I had to go to Google just to understand how to say it. But it's so rare that no one at the hospital had ever seen it before. And there were no treatment protocols for someone my age. And it was kind of crazy because just weeks before, I was at the top of my game. I just came back from a bronze-winning Team Alberta football team. I was getting recruited from D1 schools in the United States. My parents, like when we were with Dr. Mel, used to just sit in silence when she would kind of describe what we're up against. She explains that she's been on the phone talking with pediatric and adult cancer doctors all over Canada, States, and Asia looking for insight. The entire team worked round the clock for weeks to make sure I was getting the best possible care. When I was receiving chemotherapy, I can even remember just looking down at looking at my drip. As it was going drip, drip, drip. As a football player, one thing we're taught is fourth quarter is where our money's made. And I just think to myself, just keep pushing, we're almost there. This is my new home. I've been recruited here to play. Proud to say that last year I was able to play in every single game. There's still more to do to get every kid back to doing what they love. Let's keep pushing. And I'm truly thankful for what you guys are doing. You guys don't understand the magnitude of and the way you guys impact young adults and little kids' lives. And it's because of you all that I'm here today. So thank you all.
We are in an interesting time in history right now, one that underscores the need for more made-in-Canada solutions across every sector, especially in child health. Thanks to all of you and decades of generosity in this community, that we have made tremendous strides forward in helping children with mental health disorders, cancer, and brain-related diseases. Yet the reality is that they, and kids across all areas of the hospital, have more urgent needs. Needs that require taking pediatric research and care to the next level. That's why we've set our sights on creating a new Center for Research and Innovative Care, which would be built on site at the Alberta Children's Hospital. Kids will benefit from more cures and better therapies faster. Calgary has the ideal convergence of strengths, opportunities, and momentum to make this happen, to truly transform the lives of children and families here and around the world. Without question, you are the reason this vision is even possible. Together, we can ensure more cures and treatments are within reach for families who urgently need them. Thank you so much.